Hi everyone, I want to talk about a case report I got published in 2017 in the Journal of Chiropractic Medicine. Okay, so in this case report, I had a female that had tendinitis or tendinopathy. She had inflammation of her tendon of her biceps femoris, one of her hamstring muscles. Okay, and she'd been in pain for about a year and a half, and she was at a moderate intensity. She had a pain at 5 out of 10 on a visual analog scale. So basically visual analog is used to determine the severity of the pain. So 5 is about moderate. And she also had other things going on. Like she was really anxious all the time. She was fatigued. She also had trouble sleeping, and she woke up not feeling refreshed. And so those were all things that came into play as well. And she also had night sweats. Now, she had night sweats 2 to 3 times a week, and that had been going on for 2 years, okay? So actually before her pain, she had night sweats, right? Pretty crazy. So I started treating her with dry needling and auricular acupuncture, and the auricular acupuncture was aimed at helping with joint function, but also with promoting relaxation, okay? So it took about 3 weeks or so to really help to reduce her pain. You know, she had a good reduction in pain after the first couple of treatments, but it really took about 3 weeks before we had good management and control over her pain. But the biggest thing was that it took 2 months of dry needling and auricular therapy before she finally had her pain resolved. Now, you might think that's a long period of time, but consider this. We've had this whole COVID situation going on, and realistically, it started in this country probably around March, April. Well, it hasn't even been a year and a half, and it feels like it's been forever, right? And she's been in pain for a year and a half. So 2 months isn't really that bad, right, in the long run. Anyway, so the other thing that was really interesting was that after 5 weeks of treatment, she reported that she was less anxious. She was feeling pretty good overall, feeling good, right? She also stopped having night sweats. So she'd had night sweats 3 times a week for about 2 years. No longer had night sweats. So fantastic there. She was sleeping better. And she was feeling refreshed when she would wake up. And she was also less fatigued. So really good results there. And I attribute that to the auricular therapy. You know, could the dry needling have had an impact on that? Sure. You know, reducing her pain could have reduced her sympathetic activity and increased parasympathetic. She could have been more relaxed because of that. But I think that the auricular therapy probably had a major impact on all those feelings of well-being and her improvement in those other symptoms and things like that. So anyway, the article is entitled Multimodal Care in the Management of a Patient with Chronic Tendinopathy of the Biceps Femoris, a Case Report. I will put that in the comments so you can see that. You can get it for free on PubMed or at ResearchGate. And also, we still have openings for our workshop that's going to be next Saturday. So if you're interested in that, you can contact me or you can contact my wife at Holistic Hippie Housewife. All right, have a good one.